tissue management, infection management, moisture management, epithelialization or wound edge management, we are need to understand this acronym by understanding the healability condition. Either this wound healable, non-healable, and stagnated wounds. So, for example, in the tissue management, if the wound is healable, so no problem on the surgical tissue management, making aggressive debridement for the wound. But for the non-healable wounds, why you will go for the surgical? This is the principles of how we are in need to think in the time principles based on the healability status of the wound. This is not all the idea, rather than the concern of the healthcare providers is how we will think in using the dressing material to promote the healing of the wounds. We will promote, this is the wound here. And let's to say that this is healable wounds. And we will discuss the time principles on this wound. Tissue management. Maybe there is necrotic tissue, right? Wait, the black. So, let's to say that we having black tissue, black necrotic tissues. Okay. Now, this is what we are seeing from upstairs, but we don't know exactly what's going on here. So, going for the need for this one is managing the wounds, managing these tissues, and this management will require these tissues to be removed. Sharp debridement is an option, but it's not always a suitable option as we describe by the type of the wound. And in many cases, sharp debridement are risky. That maybe during the sharp debridement, we will remove other good tissues here, there, right? And it needs a special competency or privilege. As apart from the wound care training, advanced wound care training, we will go for how we will utilize the institutional policies in making or creating a wound care system. But until that level, we should take in consideration that the sharp debridement needs a special competency or a privilege, and it's risky, it will not be suitable for all cases. So, before this management come from the sharp, they discover that the body already are trying to reduce the amount of necrotic. And this is known as autolysis debridement or debridement. The body will start to minimize the amount of necrotic in this way. Based on this understanding about the body how deal with this necrotic, there are category of dressings that applied in this way, in this situation, will help us to deal with these bad tissues. First of all, what known as Hydrogel. Hydrogel, it's a very huge amount of commercial names. Almost all the wound care companies that I know, they produce this hydrogel. Hydrogel, for more than 70 to 80% of it water, and it produced with alginate to be like gel. And this, when it's come on the wound surface, it will start to rinse this, transfer this amount of gel to be fluids, and this will accelerate the hardness of this necrotic tissue. And this hardness of the necrotic tissue, with flushing, with the cleaning and so on, this will start to appear, to going out. So within the plenty of amount of hydrogel that's available for any wound care practitioner or anyone would like to provide the pressure ulcer care in this case, I will advise you to check the water to alginate percentages, and also how much the ability of this gel to stay over the wound, that will not convert all to be fluids directly with the body temperature. And it will be suitable to be used, as in some cases maybe we are in need for a gel to come here, or maybe there are some tunneling here or some groove or some cave, so the gel will be able to penetrate to this area, and this will make the wash out. There are other type of hydrogel that add further material for this component, that it's not only water and alginate. Some of them they add antimicrobial, and it's a good idea or perception that we are not working only on the time management, rather than we are working on the eye management too. So tissue management, infection management together. This antimicrobial that the companies promote, maybe some of that silver, some of that with the PHMB, some of that with, I don't know, etc. Or maybe we don't have this hydrogel. There is type of dressings related to type of hydrotherapy. It's similar to baths, and this baths full with something, and with the ringer lactate or fluids, let's to say. And this dressing has the ability to make washed off the wounds, that they will produce or rinse these fluids and again absorb what's going on, and over time this will make for lysis of these cells. Based on my information, there are two types of this category of dressings. Either something come with a one surface used, to come like bad, one side will be facing the wound, or there are like in a cavity, come on this way, and it can be go for any place of the wound, while two sides can make this process of rinsing. What can be used also for tissue management? There are plenty of items, are majorities of them, more than 90% of the available items in the market. I'm not describing here any name for the company or any commercial name, rather than it's located within this category. These pads, it can be only water rinse, fluids rinse, it can be come also with antimicrobial. It depends on what's available on your hospital or in the market of dealing with the wounds in this way. So until this level, there is tissue management, two types of dressing: hydrogel and hydrotherapy, until we will go for the next category of dealing with the wound, which is the infection management. And this is the most challenging way of dealing with the wounds when we come to describe the infection management. Again, this is the wound, and there are some part of this wound start to produce granulation tissue, but there are also accumulation of enzymes here and amount of bacteria or microbes that destroy and prevent the wounds from healing. The principles of dealing with this one, that we are in need in the pressure ulcer for antimicrobial, not antibiotic. Even now the recommendation to not use any topical antibiotics on these wounds. This is not appropriate. The majorities of the dressings come on this time as the first option for the clinicians, associated in somehow with the presence of silver. And the silver, it's a famous trademark of dealing with the wounds, as it's since, as Dr. Hussam said, it's used since ancient times about its effect in making antimicrobial effect. But how this antimicrobial effect happen, this is what make you as a clinicians in the wound care as a trademark of understanding the way of dealing with the wounds, how the silver deal with the wounds. Let's here try the word silver dressing. We are not looking for any silver. We are looking for the ionic silver. So in the chemistry, not Ag that will deal with the bacteria, rather it's Ag plus. That means the ion of silver that lost electron and now it's an active. So what happened of this silver until it will lost its electron, and this will make the scenario of dealing with the bacteria. Here are the wounds, and we know by our understanding that there are bacterial here or microbes, and we put here dressing that this dressings will have the silver. This silver should be ionized. Ionized, that means there will be transfer from this way to be Ag plus. And this silver will start to go down from the dressings to the wound bed and start to fight the bacteria. How the silver will deal with the bacteria? There are principles of silver function, and this silver function will be on three principles way of dealing with the wounds. This is the